Hi there, it's Cherylea from Anatomy for the People. In this video, I'm going to be talking about the blood supply and venous drainage of the lower limb. So let's start with the arteries and we'll move on to the veins. Okay, let's start with the abdominal aorta. So the abdominal aorta is going to bifurcate when we get down to the pelvis. As it bifurcates, the name changes to the left and right common iliac arteries. So the common iliac arteries will then bifurcate again, and we have the internal iliacs, and it continues on as the external iliac. So internal iliac here, and the external iliac here. So the external iliac is then going to leave the pelvis, and it goes under the inguinal ligament. And once the external iliac goes underneath the inguinal ligament, it pops out as the femoral artery. So the femoral artery is situated within the femoral triangle. So you have large structures there like the femoral vein and the femoral nerve as well. So the femoral artery has 6 major branches coming off it. And within the femoral triangle, there are 5 of these major branches. So the first branch that comes off is this one that pops out here and runs up. So I'll just pop that name in here. So this one is your superficial circumflex iliac. And the next branch to come off is the superficial epigastric artery. The next branch to come off is the superficial external pudendal artery. The next branch again to come off is now the deep external pudendal artery. And lastly, the 5th major branch coming off the femoral artery at the level of the femoral triangle is the profunda femoral artery, or profunda femoris. So this is the deep artery of the thigh. Okay, so as soon as the profunda femoris artery pops off the femoral artery, it gives off 2 branches. We have the medial and lateral circumflex femoral. Okay, then we follow the profunda femoris down. It's going to give off some perforating branches, which will wrap around the femur. So let's follow the femoral artery down. Oh, to go around that. Okay, so the 6th major branch that comes off the femoral artery is going to branch off as it descends towards the knee. So this is the descending genicular or descending geniculate artery. Okay, and that's going to then anastomose with other genicular arteries around the knee. So then as the femoral enters into the popliteal fossa, so now in the posterior aspect of the knee, then the artery's name will change into popliteal. So there are 6 branches that come off the popliteal artery, and they are paired. So you have this one on either side, a smaller one here, and another pair here. So all the ones that are on this side will be referred to as medial, and the ones on this side lateral. So medial and lateral. Then the names for these will be the superior geniculate or superior genicular. So that's the same on the other side. So this would be the lateral superior genicular. This would be the medial superior genicular. Then the next one down is the sural. And so that will be the lateral sural. And this would be your medial sural. Then here you will have your inferior genicular. And again, lateral inferior genicular and medial inferior genicular. So now as we pass the popliteal fossa, we enter into the leg. So we have the anterior tibial and the posterior tibial. And then coming off the posterior tibial, we have our fibula. So anterior tibial at A-tib, and this one here would be our posterior tibial, and this one here, fibula or perineal. Okay, so let's continue on with this branching over here. So I'll have my little popliteal. Okay, so we'll just zoom in a bit. And then we've got our anterior tibial here, our posterior tibial, and then giving off that fibula there. Okay, so let's have a look at the anterior tibial. So as soon as the anterior tibial comes off, it's going to be running in front of the interosseous membrane. It gives off two small branches, and so this is the anterior and posterior recurrent tibial. Oh, tib, not tub, tib. Okay, so if we follow the anterior tibial down, there's nothing too exciting until we get to the level of the ankle. Sure, you'll have small branches that are going to surrounding muscles, but nothing that is too significant. So when we get down to the ankle, we have two branches coming off, and we have the medial and lateral anterior malleolar. Then as we continue down, this is when the anterior tibial changes into the dorsalis pedis, which means the back of the foot. So there we have the dorsalis pedis. Coming off the dorsalis pedis, we have a branch on the lateral aspect and on the medial aspect. And this will be the medial and lateral tarsal arteries. The dorsalis pedis will then turn into the arcuate artery as it goes over the dorsum of the foot. And the arcuate is going to give off your dorsal metatarsal arteries. And then your dorsal metatarsal arteries will give off your dorsal digital arteries, which will run up on each side of the toe. You will also get a branch of the dorsalis pedis that is going to contribute to the deep plantar arch. And coming off the deep plantar arch, we will have the plantar metatarsals, and then our plantar digitals. Also coming off the dorsalis pedis, you're going to have one branch that goes to the first toe, and so this will be your first dorsal metatarsal. Not sure why I decided to spell this one out completely, and this one's just all abbreviations. So I'm predicting that it's going to get very messy around this area, so you're just going to have to follow me closely. All right, so now let's look at the posterior tibial artery. So when this runs down, again, nothing too exciting happening. Small branches going to surrounding muscles. Okay, so when we get down to the level of the ankle, this is where we start supplying malleolar structures. So we had the anterior malleolus covered, the anterior part, medial and lateral. So then coming off the posterior tibial, we have the posterior malleolar, and this will be the medial posterior malleolar. Then coming off underneath that, you will have just plain old medial malleolar branches. And here, when you get to the end, it's going to split. And I've kind of shot myself in the foot here. We're putting dorsalis pedis here. Let's just move this so I can actually draw this in a nice way. Okay, so we know that this section here is our dorsalis pedis. Okay, so apologies for that. The posterior tibial, we then have them branching off into your medial and lateral tarsal. Okay, and then also before that bifurcation, you have little branches coming off, which are calcaneal branches. Okay, so your tarsals, this is going to be very messy, so you're just going to have to look at my pen. So your lateral tarsal artery is going to anastomose with your deep plantar arch. So let's just do a little asterisk. Goodness me, that's just a weird one. So it's going to anastomose here, whereas your medial tarsal, let's just do a little love heart, that is going to anastomose directly with your deep plantar arch and the plantar metatarsals as well. Just to add in here, hopefully it'll fit, but also coming off your deep plantar, you have another branch which actually makes the superficial plantar artery. And you also get your medial tarsal arteries anastomosing with those vessels. So let's continue on with the fibula. If we have space, we will make it fit. The fibula is going to be coming off the posterior tibial. The first branch it gives off is the nutrient artery of the fibula. So nutrient, or the nut. Again, as we move down the fibula, there's nothing too exciting. Some perforating branches, one's going to the muscles that are around it. And as we actually move down, and we're just going to have to do a little bit of a detour here, but remember it just runs straight down, but this is just for the sake of space. We're going to have the lateral malleola coming off here. So it would be the lateral. So I'm just going to write lateral here because it's going to pair up with this. So it'll be lateral posterior malleola. So then you can see that the posterior aspect of the malleoli will be supplied by branches from the fibula, but then also branches from the posterior tibial. Okay, so then when we get to the bottom of the fibula, then we just have calcaneal branches. And they're going to be anastomosing with the calcaneal branches of the posterior tibial artery. Okay, so that's it for the arteries of the lower limb. So let's move on to the veins. All right, so let's have a look at the veins. We will start from the foot and we'll work our way up. So I'm going to start with the superficial veins because trying to do both superficial and deep is kind of impossible when you're drawing it like this. Okay, so let's start with the foot. We have our dorsal venous arch. And draining into the dorsal venous arch, you will have your dorsal metatarsal veins. And then running into those, you will have your dorsal digital veins. So dorsal digital, and then your dorsal metatarsals. Okay, I won't write vein. We know we're dealing with the veins here. So let's say that this side is medial and this side is lateral. So the blood that has been collected by the dorsal venous arch, that will eventually run into either the small saphenous vein or the great saphenous vein. So we know those as the large superficial veins that run up the leg for the small saphenous, and then up all the way up to the groin for the great saphenous. So laterally, we're going to have the blood draining into the lateral marginal vein. And then the lateral marginal vein will then drain its blood into the small saphenous vein. So as the small saphenous vein runs up the posterior aspect of the leg, we're going to have lots of superficial veins draining directly into it. And then the small saphenous vein is then going to run into the popliteal vein. Okay, the medial aspect of the dorsal venous arch is going to eventually drain into the great saphenous vein, and it does that through the medial marginal vein. Okay, then we have the great saphenous running up the medial aspect of the leg, passing the knee, and then running up to then drain into the femoral vein. Along the way, we'll have a lot of superficial veins draining into the great saphenous. So the region here where the great saphenous vein drains into the femoral vein, this is called the sapheno-femoral junction. And so the sapheno-femoral junction, or the SFJ, has quite a few veins that are all converging on this site. So I'm just going to draw the sapheno-femoral junction here and just show you all of the different veins that are going to be draining into the great saphenous and therefore into the femoral vein. All right, so here we'll do our sapheno-femoral junction, and here we have the femoral vein, and then our great saphenous coming in. So remember, the femoral artery at the level of the femoral triangle, which is where this is situated as well, we had 5 of the main branches that come off femoral, all coming off there. So the names of the veins that actually drain into the great saphenous, just this, they share similar names. Okay, so I'm going to just draw the veins in kind of coming in all different directions, because you need to keep in mind that at the sapheno-femoral junction, there's a lot of anatomical variation. However, the veins that I do draw, they're all generally going to be there. So it'll just be their location that might change a little bit. Okay, so 6 main veins draining into the great saphenous. And the first one will be your superficial inferior epigastric vein. And then when we think about its arterial counterpart, that was the superficial epigastric. So its name is just slightly changed. We also will have the superficial circumflex iliac. Okay, same name as the artery. We will also have the superficial external pudendal vein. We will also have the deep external pudendal vein. Okay, 2 more. We have anterior and posterior accessory great saphenous veins. Okay, so they're the 6 that are draining into the great saphenous vein before it enters into the femoral. So that is your sapheno-femoral junction. Okay, so let's now move on to our deep veins. So I'm still going to draw the dorsal venous arch, because the dorsal venous arch will also drain into some of the deep veins. Okay, so I'm just going to draw it a little bit higher, because we need to also draw the plantar venous arch as well. Okay, and just to keep consistent, we've got our dorsal metatarsal veins with our dorsal digitals. Then we've got our plantar venous arch, which will have plantar metatarsal veins and the plantar digital veins. The dorsal venous arch, as we know, is going to drain into the medial marginal and the lateral marginal to end up in those superficial veins, but it also gives off a deep branch where it also joins up with the anterior tibial vein. So the plantar venous arch, that is going to drain into the posterior tibial veins. And there are 2 of those. They join together. And as soon as they merge with the anterior tibial, that turns into the popliteal. So this is your posterior tibial, both of these, right? Okay, so then your plantar venous arch, then that's going to be deep. So I'll just do a little asterisk here. That's going to drain into either one of the posterior tibial veins, whatever's closest. Do a little love heart here. And it's going to anastomose with that there. Okay, so draining into one of the posterior tibial veins, you will have a fibular vein. And running in between the fibular vein and the posterior tibial veins, you will have the soleal venous plexus. So all of that in there is the soleal venous plexus. So all of this runs up to end up in the popliteal vein. And so let's now look at the popliteal vein in a little bit more detail, because this is a little bit too small. Okay, so we had our anterior tibial vein joining up with the posterior tibial veins to become popliteal. And so remember, the popliteal artery, we had 6 branches that were branching off, whereas in the venous system, we only have 4 veins coming in. They're still paired. This is going to be your medial and lateral superior genicular, inferior genicular. And then the names are going to be the same on the other side, but you'll have lateral superior genicular vein and your lateral inferior geniculate. So then the popliteal vein then changes into the femoral vein. So now we're at femoral. As we move up, we're getting blood coming in from the profunda femoris vein, or deep vein of the thigh. As we move up, then we get the great saphenous. And then remember that junction was that sapheno-femoral junction. And don't forget to mention, I'm telling myself, don't forget to mention, remember that the small saphenous vein was draining in here as well. Just if we're zoomed in, may as well put it in, small saph. Okay, and then once the femoral then passes that inguinal ligament, then it goes up and becomes that external iliac vein. And then from external iliac vein, we have the common iliac vein, and then that drains into the inferior vena cava. Okay, that's it. Thanks so much for joining me. See you next time. Bye.